Thank you, girls. We hope you've enjoyed your lunch. SPA, spiritual, physical, and attitudinal. Thanks for joining us back in here as we sharpen our mind for those of us that need expertise and mental health. We have Dr. Lulu Tsai, psychiatrist and Calvary Eastlake member, who will be joining us today. Her undergraduate is from the University of Rochester in Rochester, New York. She attended medical school at Drexel University. Her residency was at Pennsylvania Hospital in Philadelphia, PA. She worked as an outpatient psychiatrist for over 20 years, college counseling, community mental health centers, psychiatric consultant to drug and alcohol rehab. And she is married to her husband, George Tsai, for 29 years. They have 3 sons, 25, 23, and 17. She has 1 dog. She's originally from Taiwan, and she enjoys spending time with her family, walking, watching movies, and traveling. So I welcome to the stage my girlfriend, Dr. Lulu Tsai. Thank you.
Is everybody awake? After lunch is sometimes difficult to stay awake. So just to wake you up, a joke, psychiatric joke. So how many psychiatrists does it take to change a light bulb? Anyone? 1, you're right. But the light bulb needs to want to be changed. Right, so the idea of psychiatry, I think over the years maybe people have different ideas of what mental health or what psychiatrists do. Just to clarify, I'm not a psychologist. I was medically trained at a medical school and also went through a medical residency training for psychiatry. So the ideas of psychiatry perhaps is scary for some people, especially for believers. I was a Christian first before becoming a physician. And so hopefully the talk today will help us to see mental health a little bit differently. And so this is a little cartoon of what Lucy's psychiatric help was like. So next, about mental health. So it's a big topic. However, mental health, people can have poor mental health. It doesn't necessarily mean that they have mental illness. So in terms of mental health, I think earlier when we had other talk on functional medicine and hormonal and then also immunity. And all of these can affect our mental health. So having good mental health is actually important to make sure that we can function normally. So the next slide is a little bit busy. These are the definition by CDC and also American Psychiatric Association of what mental health is about. And so mental health, essentially we look at the health or well-being psychologically, emotionally, and socially. And then all of this will impact how we function. And so APA talks about it can affect our relationship, our ability to function at work, and then also as a person. And it affects how we communicate with others in our relationship. So when you think about mental health, it's actually something that we ought to pay attention to. And being a Christian and being believers, we ought to pay attention to our mental health. And the Bible has a lot of good advices and principles that we can adhere to improve our mental health overall. I want to don't have a lot of time, so the next slide is mainly about mental illness. And I kind of wanted to talk about that because we don't talk a lot about mental illness in the church overall. Historically, actually, the church played a big part in taking care of mentally ill patients. You think of like the Catholic Church, the monk, they actually contributed to a lot of early care for people who are mentally ill. And mental illness is real. unfortunately. I wish I can say that it's not. So one of the things when I was choosing my specialty in medical school, the question is, does psychiatry, should Christian choose to go into psychiatry? And what can I do as a psychiatrist? Because a lot of, maybe some of the teachings and the theories that we learn about human development, religion or faith may be pushed to the sideline. But that's not the case anymore. Actually, there's more recognition of people with faith, actually how that contributes to their overall mental health. However, mental illness is real. Mental illness is actually a physical disorder. It affects not just physical symptoms, but possibly neurological symptoms. So mental illness significantly, next slide, sorry, change our thinking, emotions, and behaviors. And the distress and problem of functioning in social and work and family activity can really impact a person's function overall. And unfortunately, mental illness does not discriminate. Anyone can have it. It affects anyone regardless of their age, their race, their genders, where you're coming from, or your social status. And so, and even, I think that even for believers, sometimes it's difficult to imagine, if I believe in God, why do I struggle with mental illness? It's not a sin, it's a mental illness. Okay. So these are some of the psychiatric diagnoses that I address in my practice. And there's several, there are actually more on the list I didn't include, but these are some of the common ones we're confronted with. And typically these are the people who really have been negatively impacted by their illness to come in. Most of the time I see people with mood disorders, anxiety disorders, post-traumatic stress disorder or stress-related disorders. And then there's, unfortunately, some patients struggle with substance abuse, which negatively impact on their mental health issues. Neurodevelopmental disorders such as attention deficit hyperactivity disorder or autistic spectrum disorder. And these are some of the things that we have to address and hopefully treat and improve their quality of living. And as we get older, unfortunately, we also will have sleep disorders, whether we like it or not. It just becomes harder and the sleep becomes shallower. So we see a lot of that as well. Okay. So statistics on mental health. So this is from data in 2019. More than 50% will be diagnosed with mental illness or disorder at some point in their life. That's 50%. That's the entire population. That's a lot. And 1 in 5 Americans will experience a mental illness in a given year. 1 in 5 children will currently or at some point during their life have a severe debilitating mental illness. And 1 in 25 Americans live with serious mental illness such as schizophrenia, bipolar disorder, depression. And so the numbers are astounding, and it's not something that we ought to ignore or think that by praying harder or that we can get over. Sometimes we need more help than that. So many factors affects mental health. We talked actually earlier, there's a lot of, there are other talks that address some of the things and factors that affects physical health. And same thing, there are factors affecting mental health as well. And we need to pay attention to our diet, our physical health, and our relationship, some of the things that we have more control over. Sometimes we can't control losses in our lives. We can't control our genetics, and sometimes we can't control the stresses, like the pandemic. It's out of our control. And so, but there are things that we can do. So that's essentially summarized the picture earlier. But there are things that we can do to improve our overall mental health so that hopefully we will not have to struggle with mental illness. But if there are people struggling with mental illness, please don't ignore it. Please get help. So the current help that we have include psychotherapy, both individual, group, for cognitive behavior therapy, interpersonal or psychodynamic, pharmacotherapy such as medication. Medications are tools, they're resources. They're not to solve all of your problems, but they can be helpful. Just like if you have diabetes, you will take insulin, hopefully, to manage your glucose level. Or if you have asthma, you would take an inhaler to help control the wheezing and shortness of breath. And if you have depression, antidepressants can be helpful. Again, they're not to answer or solve all the problems, but they can be a resource and a tool to help you get better. Lastly is other treatments, such as brain stimulation. What's available right now are electroconvulsive therapy or transcranial magnetic stimulation. They're also over-the-counter electric stimulation as well, but they do seem to offer additional benefits for treatment. Coming back to the group therapy too, I wanted to mention that there are support groups in the community. So for example, such as NAMI and AMI, it's National Alliance for Mentally Ill, and that's actually mainly supported and run by patient families. And so their goal is to educate and to bring mental health awareness in the community and hopefully improve the quality of care. And then the other groups such as Celebrate Recovery, which started in Saddleback Church in California. It's a Christian 12-step based support group that addresses mental health needs. I can't finish the talk without talking about suicide because unfortunately the number is astounding in terms of how many suicides that we're confronted with. It's actually the top 10, number 2 in terms of for public health. There's enough death caused by suicide that we actually should not ignore. There are warning signs that people ought to pay attention to. So if you come across with people, or friends or family who are talking about their wish to die or they want to hurt themselves, or if there's enough stress in the family and you find someone who is in need, please get help for them or at least advise them to get help. Okay. And just some warning signs. Okay. And lastly is, So there are national hotlines that people can reach out to. And right now, the National Suicide Prevention Lifeline is 1-800-273-8255. Or there's a text number, 741-741, to get help as well. So if you know someone or someone is at risk of maybe possibly taking their own life, please reach out to help. Locally, certainly contact 911 or take your friends or encourage them to go to the emergency room. Okay. So, and in terms of psychotherapy, we wanted to make sure that consider individual psychotherapy. I know that sometimes that can be scary, and most people who are in the church probably seek out help from their pastor or pastor's wife first. However, if you really are struggling and not getting better, even with these pastoral counselings, please get help. And there are licensed and well-trained psychotherapists in the community that can offer help, and don't be scared to at least, make an appointment and check things out. Good therapists, regardless of their faith backgrounds, will be able to offer help, and you just need to be upfront about your belief and your religious faith, and they should be able to help you, and they will not ignore your faith experience, and so don't be scared of getting help, even if you think that if you're afraid of seeking help from someone who may not be Christians. And lastly, a support group I mentioned earlier, NAMI and Celebrate Recovery. Okay. And Benjamin Franklin said it well, an ounce of prevention is worth a pound of cure. And that's when it comes is that the prevention is that we need to live more healthy and have a healthy attitude and with better social interactions and connections. So healthy living is, I think, that what we address today with exercise and nutrition, and then taking care of our health, because our body is the temple of God. It's our responsibility to take care of it. Healthy attitude, that's where the mental part come in. The proverb says that cheerful heart is good medicine for the soul, and it's true. If we're able to have a healthier attitude, it will affect positively our mental health and physical health. And lastly is social connection. And I think that I'm so glad that Stephanie has this exercise group, because it's not only that we focus on physical fitness, but also that social connection. It's so important. I think that even sometimes in the church, we feel alone. And so how do we, as a church, as a congregation, to help improve that and to make sure that people are connected with each other well? So, and I think that may be the end of my slides, and I added a slide after I submitted. So I just wanted to part with you on a verse that has been very helpful to me, and hopefully that will help you as well. So let me find that. Sorry about that. I should have printed out. So it's from 2 Corinthians 12, 9 to 10. Okay, this is when Paul talked about that he has a little thorn on his back, and he asked God to take away from him. But God said to him, "My grace is sufficient for you, for my power is perfected in weakness. Therefore, I will most gladly boast all the more about my weaknesses, so that Christ's power may reside in me. So I take pleasure in weakness, insult, hardships, persecution, and in difficulties, for the sake of Christ, for when I'm weak, then I'm strong." So even if you struggle with mental illness, know that God doesn't abandon you. I think that as a Christian, we have such a hope in Christ that we're never alone, and he will not abandon us. So hopefully that's an encouragement to you.
Thank you. Thank you, Dr. Lulu Tsai. We appreciate you. God bless you and the lives of those that she's able to treat.